of kids aged 2 through 5 drink a soda or more per day. And you can see the differences in geographic areas. Alameda, 24%, but down in the Imperial Valley, 60% of young kids are drinking a sugar-loaded beverage or more per day. Big differences in ethnic groups as well, as you can see. The science on this clearly linked, overwhelming evidence, different than what the beverage industry will say, overwhelming evidence of the link between obesity and diabetes. The product has no nutritional benefits at all. My favorite argument from the beverage industry is that it hydrates you, right? And it actually turns out that for young kids who are really sensitive to diuretics, because so many sodas have caffeine, when young kids drink soda that has caffeine, it's actually a net liquid loss. They get dehydrated. It's not true for adults, but for young kids, it's true. But so they say it hydrates you, right? And it's water that hydrates you. Drink the water. You don't need to eat the 17 teaspoons of sugar. There's also this pretty remarkable new research showing that we don't compensate for the calories that we drink the way we do calories that we eat. We literally are not biologically equipped to recognize the calories that we consume in liquid form. And if you think about it, at your lunch today, I think everyone had water, right? If you had a regular Coke instead, would you have eaten anything differently? Would you have eaten less? The science shows you not only wouldn't eat less at this meal, you wouldn't eat less throughout the rest of the day. If, on the other hand, you had 250 calories of dessert, over the course of the day, you'll end up eating a little bit less. And we literally don't have the radar mechanism to recognize liquid calories. All of those liquid calories. Also, as we know from that elementary school experiment of dropping a tooth or a bone into a soda, soda is a primary cause of dental decay. Kids who drink soda are twice as likely to get cavities, and it's often these worst kinds of cavities. It's also the product most marketed to kids. $500 million a year spent just marketing soda to our kids. And think about how the beverage environment has changed over your lifetime. Portion sizes have changed, certainly. In the 20s, a bottle of soda was 6.5 ounces. For a long time, all there were cans, 12 ounces. Now 20 ounces. That was new, not all that long ago. And now they have these liter bottles. There's a lot of work that's been done on defaults. Whatever it is that's provided as a default is what you're most likely to do. So if your employer has you signing up for your retirement plan automatically, almost everybody is signed up for their retirement plan. But if you have to choose to do it, the sign-up rates are much lower. So whatever the default is what people consume. What's the default beverage size now? 20 ounces, pretty much, right? What's the default beverage size when you go to a fast food restaurant? Right? It's got to be 32 ounces, probably, right? So that's what we eat. That's what we drink with all that sugar without thinking about it. How many of you remember six-packs? They don't exist anymore. The six-packs have become 12-packs, and the 12-packs are now 24-packs. And now I have no idea what this advertisement means. It's a new twin-pack, enough for your meal. It's a twin-pack of 50-ounce bottles. It's true. If you do that, that's your whole meal. How many teaspoons of sugar in 100 ounces of soda? Probably 80. But soda is also everywhere. Think of that aisle down the supermarket with all that sugar. We've started going around and taking pictures of where you can find soda. So there's the soda machine in the mall. There's now the soda refrigerator. While you're filling up gas, you don't even have to go inside to get your soda. Remember, years ago, what gas stations had was a building, and what did they use with that building? What was that for? They fixed your car, right? But they make a whole lot more money taking all that and put junk food in, right? But people have to put some effort in and go into the store to buy the soda and junk food. Now, while you've got your, while you're filling up, you might as well just get it right there. Also turns out that soda over the course of time has become the best deal on the market. Over the last 30 years, the average price of fruits and vegetables in real dollars has gone up almost 40%. The price of carbonated sweetened beverages has gone down almost 40%. Right? A soda's been a $1 for an awfully long time. As if it's not a good enough deal, I've started noticing the advertisements in the Sunday paper. Almost always there's an advertisement for soda on the front page of whatever the ad is. Here's CVS Pharmacy, where you can get a gallon of soda for 88 cents. As if that's not bad enough, you could instead go to Rite Aid, where instead of 3 12-packs for $9.99, it's on sale. You can get 3 12-packs of soda for $7.99. It's insane. As a result of all of those changes, it turns out that over the course of the last 30 years, this isn't on the soda side of the story, first just in general, over the last 30 years, on average, all of us eat 278 more calories per day. Completely explains the obesity epidemic. Don't tell anyone physical activity rates really haven't changed all that much. They would have to compensate for that, but they haven't. So we all eat 278 more calories per day. Of that, 120 are new soda calories. 43% of all the new calories that Americans have been consuming come just from soda. Making soda, without question, the leading contributor to the obesity. So whereas we've all been saying, and it's true, obesity is a very complex problem, there are a lot of factors, there's no single smoking gun, but there's half of a smoking gun. And the half is all that sugar